It's Mike Brennan, and we're doing another segment on MITech TV. And my longtime co-host, God, I was just talking to somebody this morning. I think 10 years now we've been
Yeah,
doing
we've
them.
been doing this since 14, I think.
Is it that long? Gosh.
Yeah.
And
Anyway, we want to welcome to the program today Stacey Frankovich, who is director of a new center at Lawrence Technological University. It is called the Healthcare Violence Reduction Center, which is an interesting title and an interesting topic. So, Stacey, welcome to the program.
Thank you for having me.
Okay, so let's start at the beginning, I guess, is the best place to start. Please explain for our audience what the center is and what your role in it is.
Sure. So the center is dedicated to helping the healthcare providers reduce workplace violence through innovative and research-based solutions. We built a mission that is to empower healthcare providers with innovative research-based solutions that effectively reduce workplace violence, ensuring the safety and well-being of both staff and patients. So as the director of the center, my responsibilities include being a liaison with our public and private partnerships. So I work closely with our hospitals and the Michigan Health and Hospital Association, our funding partners. I work closely with our board. I manage staff and work very closely with the LTU researchers who are going to be working on these projects. And working with all the different stakeholders that we can collaborate with to tackle this problem and oversee the different solutions that will, I shouldn't say may, but that will come out of our research and our efforts.
okay, so what is the mission and the vision of your HVRCP? But I can do it. Program. Yeah.
Great question. Great question. So our mission, again, is to, to create a safer healthcare environment where every provider can deliver exceptional patient care without the fear of violence. Right now, that is a real fear that does exist. So we want to help to remove some of that fear. And our mission is to empower the healthcare providers with research-based solutions, as I mentioned earlier. And we really want to do that through our values. We want to show integrity and uphold the highest standards in our research and our solutions. We want to collaborate with all of our different partners, including health providers, but also third-party vendors to the health system, such as security service providers, training partners. We want to show compassion and committing to the well-being of patients and healthcare workers when we're looking at these solutions. Excellence, we are really striving for superiority and quality in all of our initiatives and our measured research and solutions. And of course, innovation. We do want to innovate. We want to be new and different and try to look at this problem from other angles and different approaches.
So tell us a little bit of, if you can, about how the center came to be. What sort of motivated its creation?
Sure. So the center was really established in response to the alarming increase in workplace violence. This is happening in healthcare settings across the United States, and we recognize the urgent need for the effective solutions. LTU really wants to leverage its strength in multidisciplinary research. We have 5 colleges that bring with them a wide variety of opportunities for us to use research and develop real world solutions that can impact everyday healthcare workers and identify real great solutions to some of these problems, and work really closely with our healthcare providers, our industry partners, and our academic experts. So the center was really formed to focus exclusively on reducing violence. We are not anything other than what we claim to be. That is our pure focus, is looking at that specific topic.
Well, let me dig a little deep. When you say violence, violence against the patients, violence against the healthcare workers, I guess I don't quite understand where the violence is.
Sure. So the violence is it can be looked at from a lot of different perspectives, but primarily it is patient on healthcare worker violence that we are looking at primarily right now. And that isn't to say that there isn't patient on patient violence, there isn't patient family on healthcare worker violence, but we're primarily focused right now, and we're fairly new. So right out of the gate, we're going to be looking at patient on healthcare worker violence. And this is a broad problem. This is not a new problem. This has been going on for a lot of years. Some people think that maybe COVID started this or was part of this, but it isn't. COVID may have exacerbated it or brought it a little bit to the forefront or to people's attention, but this is a problem that's been going on for a long time. Our healthcare workers are taking verbal abuse, physical abuse, threats. They're taking a lot of it on. And unfortunately, a lot of it goes unreported. So it's very difficult to tell a full story about what really is happening. And we're hoping through our research to be able to dig into that a little bit further and tell that deeper story.
So tell us a little bit about the HVRC's partners. Who are the partners? Why are they important? How did they come to join in this effort?
Sure. Well, our first and founding partner is the Michigan Health and Hospital Association and their Keystone Center. So in particular, their Keystone Center, which is focused on quality and safety practices. They came to the table first and early. They saw what we were doing. They were eager to help. And they are helping to ensure that our efforts align with the highest standards in patient and staff protection. So they really do bring the entire Michigan hospitals, that entire network with them. The Keystone Center can provide access to a broad network of healthcare organizations. Not only do they bring the health systems, but they can bring, like I mentioned, those third-party vendors to the table, the security experts, the training companies. So we're able to get them to the table too, to understand how our potential research findings can be implemented, how we can use what we know in trainings and in other ways to get them disseminated into the hands that they need to be in. So they're really helping us create that wide-reaching platform for collaboration and the dissemination of our findings. So we're very, very grateful to have the Michigan Health and Hospital Association and their Keystone Center as a prime partner. Our other partners include University of Michigan Health West and University of Michigan Health-Sparrow. And what is so exciting about having them with us is that they're providing essential real-world insights and firsthand data that ground our research in practice and experience. Their involvement really allows us to tailor and strengthen our interventions to the realities faced by the healthcare professionals that are living it day to day. They're on the front lines. And by collaborating really closely with these hospitals, we can conduct pilot programs and collect the relevant data that we need to get direct feedback on our approaches. So this is real-time collaboration. This ensures that our solutions are not only research-based, but also applicable and effective in real healthcare settings.
So, what kind of research will the HVRC and its partners conduct?
Sure. We are positioned to do all kinds of research because, as I mentioned, we have 5 different colleges that can contribute. So we can conduct a comprehensive range of research, but our first project is going to focus on creating source of truth data. So as I mentioned earlier, it's really hard to understand the problem because right now we have what's called OSHA reportable incidents. And that's a really important piece of the puzzle because when something is OSHA reportable, that's an injury that was significant enough that it created a workman's comp, for example, report. So somebody lost work or lost time due to that injury. However, what we don't capture most of the time are those other incidents. So we'll call that the other. And those are maybe the verbal assaults, the threats, and those are the types of things that, are so compounded, and that really drives into the burnout. And so much of what is causing our healthcare workers so much stress and anxiety. And that often doesn't go reported. So we really want to dive into all of that and really try to understand all of that verbal abuse, the threats and the incidents that often go unreported, so that we can aim to improve and understand the problems, so that we can provide more accurate representation of the risks. So that's project number one. And then we can begin to explore practical solutions and initiatives that translate those findings into effective strategies. This could involve predictive analytics models, which could help assess and mitigate risks. While we could also move forward into innovative technology solutions, we can look at robotics, emergency response technologies. But overall, the HVRC research will provide evidence-based recommendations, tools and interventions that can be adopted. And then we can improve safety from a place of knowledge, from a place that we truly know is the baseline of truth. And maybe we can move that needle a little bit and reduce that burnout and be able to tell our healthcare administrators and our leadership a much better, I shouldn't say much better because it's a terrible story, but give them a better view of what truly is happening.
Okay, and I understand that you are still searching for more hospital collaborators and healthcare system collaborators. Tell us a little bit about the value that they'd receive if they join this effort and why you think they should.
Sure. We would love to have more partners join us. LTU is really well positioned to tackle this problem. And we think that there are 3 reasons why a hospital would be interested. Obviously, to protect their workers. 52 nurses are being attacked every day in the US.
Wow.
This is unacceptable when you consider that these workers are the ones caring for others. So when I say 52 nurses are being attacked every day in the US, remember, this is what is only being captured. So there are things happening that isn't being captured. The second is that violence is harming patient care, which is being reported by 90% of emergency room doctors. So our doctors see it, they know what's happening, and it is impacting patient care. And the third, we are cost effective for the hospital. Their funds go into a shared pool of funds that we use to do the research and make those recommendations that are shared with other contributors. So currently, a hospital can receive research and recommendations that are, that will duplicate their contribution. The more contributions we have, the more research we can do, the more we can disseminate, and the more that shared information can be passed on to these additional hospitals. We can get in and do pilots in their facility. We can work with their frontline healthcare workers. We can share their specific data with them and help to address their specific problems. So we think it's a really good opportunity to partner with us and be right on the front lines with them.
Okay. All right. So if people want more information about this center, where do they go? Who do they talk to? I mean, I know they would talk to you in part, but how do they get a hold of you and the center?
So they can go to ltu.edu/health-sciences HVRC, which I know is a really long website, but I think the best way is just to come to S. Frankovich, which is part of my last name, at LTU.edu, and just reach out to me directly and we can talk.